everyone to our second session of our Lunch and Learn series, Centering the Child. I'm Emma Nugent, Project Officer at the Centre for Excellence in Child and Family Welfare. Today's session will explore the importance of including children's voices into family violence risk assessment and management. We'll be using a case scenario to guide our discussion and hear from expert panelists about trauma-informed practice and child-focused responses. But before we begin, I would like to acknowledge the traditional custodians on the lands on which we meet. The Centre for Excellence in Child and Family Welfare would like to acknowledge and pay respect to the past and present traditional custodians and elders of this country on which we work. We also acknowledge the injustices and trauma suffered as a result of European settlement, including the stolen generations and forced removal of children. We honour and respect the resilience of Aboriginal and Torres Strait Islander communities and the ongoing aspirations for self-determination and empowerment. I am pleased to be continuing our Centering the Child Lunch and Learn series today. This 4-part series is designed to support practitioners in aligning their practice with the MARAM framework, particularly when working with children and young people impacted by family violence. We know that children are victim survivors in their own right, and that their experiences of family violence can significantly affect their development, emotional well-being, and sense of safety. The series aims to strengthen our collective understanding of how to respond in ways that are child-focused, trauma-informed, and collaborative. Today's session will explore the importance of child-inclusive approaches in risk assessment and management, including children's voices, not only supporting their recovery, but also empowering them to make meaningful decisions about their safety and future. We'll be using Hayley's case scenario to guide our discussion. Her story reflects the complex realities children face in family violence contexts and will help us explore how to respond in ways that are trauma-informed, developmentally appropriate, and collaborative. This is the second of our 4 sessions in the series, and in our first session, we explored how trauma impacts child development and attachment. Today, we'll build on that by focusing on risk assessment and safety planning. We'll be taking the learnings from the first session with us as we shift towards today's session objectives, which are understanding how to meaningfully include children's voices in family violence risk assessment and safety planning, ensuring that their perspectives inform decisions and affect their well-being, exploring practical strategies for safe and sensitive engagement with children and young people, including techniques that support emotional regulation and build trust, and lastly, recognizing the impact of trauma on developmental milestones and attachment, and learn how these effects can shape a child's behavior, relationships, and sense of safety. We'll take a brief moment now to highlight 2 foundational responsibilities under the MARAM framework, which will underpin today's session. The first being Responsibility 3, Intermediate Risk Assessment. So this involves identifying the level of risk to children and young people, including recognizing patterns of harm, cumulative risk, and the child's own experience of violence. It requires practitioners to use structured professional judgment and evidence-based tools while also considering the child's voice and developmental needs. And we'll look at Responsibility 4 as well, which is Intermediate Risk Management. So this responsibility focuses on developing and implementing safety plans that are responsive to the child's unique circumstances. It includes engaging with the child and their caregivers where safe and appropriate, coordinating support across services, and ensuring that interventions promote recovery, resilience, and long-term well-being. Just a quick note on housekeeping before we dive into our facilitated question and answer session with our panelists. Today's session is being recorded. Audience members' microphones and cameras will remain off by default for the duration of today's session. If you experience technical issues, please try exiting and rejoining. If not, I'm monitoring the chat box and can assist audience members if needed. If you have any questions or reflections for our panelists today, please use the question and answer box for these. And also noting that some of today's content may be distressing, so please take care when listening and engaging, and please reach out to support services that I'll list in the chat shortly if any concerns for you or others have come up today. We encourage you to engage actively in today's session. Share your questions, reflections, and experiences in the chat and question and answer box. This is a space for learning, connection, and strengthening practice together. Thank you for being here. Let's take a look at today's case scenario. So you all should have received a copy of the case scenario and the relevant material before our session this morning, but we'll be going through the case anyway to ensure that everyone is on the same page. So Hayley's story will guide our discussion. Her experiences reflect the complex realities that children face in family violence contexts. So let me introduce you to Hayley now. Hayley is 12 years old and lives with her parents on a dairy farm. She attends a small local primary school, and recently she's noticed increased conflict between her parents, especially around financial stress. Hayley is experiencing anxiety, poor sleep, and emotional distress. Her story reflects the complex realities children face in these contexts. Hayley's father has been drinking more and becomes angry and aggressive when intoxicated. Hayley has witnessed yelling and property damage during arguments. She feels responsible for her mother's well-being and has avoided school to stay home. When police visited, she downplayed her fear to protect her father. This illustrates how children may internalize responsibility and minimize their own safety concerns. Hayley's mother confided in a friend about the escalating violence and her own emotional struggles. She is experiencing symptoms of depression and feeling overwhelmed. Hayley hopes someone can help her family. This highlights the importance of peer support and the potential for informal disclosures to lead to help seeking. Let's take a bit of a closer look at Hayley's profile now. So Hayley is in year 6 and experiencing school can't. She has anxiety, irregular sleep, and psychosomatic complaints. She is at risk of depression if support isn't accessed. Her interests have faded and she spends time alone on her iPad. She is deeply affected by her mother's distress and wants to help. Understanding these signs helps us assess risk and tailor support for Hayley. Let's move on to Hayley's mum now. Hayley's mum is emotionally overwhelmed and experiencing coercive control. She shows signs of depression and trauma responses, like hypervigilance and avoidance. She has limited social support, and her needs are mental health support, safety planning, peer connection, and GP assessment and possible referral to public mental health services. Now on to Hayley's dad. So Hayley's father is showing signs of significant distress and behavioural concerns. His alcohol use has increased and he becomes impulsive and angry when drinking. He may be experiencing depression or anxiety, as suggested by irritability and hopelessness about the farm and finances. He's defensive and ambivalent about seeking help, which is common in cases involving shame or denial. He needs a multi-pronged support approach, which could include alcohol and other drug intervention, addressing the use of family violence, anger management, as well as mental health assessment, with potential referral to public services if risk escalates. Understanding the dynamics between Hayley's parents is crucial for assessing risk and planning interventions that centre the child's safety and well-being. Today, we're joined by 3 expert panelists who will share their insights and strategies from their practice experience. We're joined by Astrid, Integrated Practice Leader from the Orange Door, Kylie, Clinical Leader for Take Two at Berry Street, and Catherine, Senior Family Therapist at Kids First. They'll help us unpack key concepts and apply them to Hayley's case. Our panelists today will share approaches to trauma-informed care and how to support children's recovery and resilience. I'll stop sharing my screen now and we can introduce our wonderful panelists. Bear with me as I spotlight them for everyone so we can all see their beautiful faces. Amazing, here we go. Welcome everyone. Let me introduce you all to our lovely panelists. So Astrid is a social worker who has worked across housing, family violence and family services. Astrid is currently working in a practice leader role in the Orange Door Network, with a focus on promoting the voices of children and young people as individuals with their own unique experiences and needs. Kylie is currently clinical team leader for Take Two Northern Metro. Kylie has been in this role for 3 years now and has worked with Take Two for 5 years, previously working in the Waddle program. Prior to this, Kylie worked in similar NGOs, focusing on family violence and sexual abuse and also in the education sector. She is an accredited mental health social worker, clinical family therapist, accredited EDMR practitioner, and holds a master in social work and clinical family therapy. She also works in private practice providing therapy and supervision. Catherine is a senior family therapist at Kids First, currently working predominantly with family and domestic violence impacted clients and supervising within the NHARP Family Violence Recovery Team. Formerly, Catherine has held positions with Macaulay Community Services for Women, Safe Steps, and 1-800-RESPECT, working in crisis, refuge, outreach, and therapeutic roles. Welcome, Astrid, Kylie, and Catherine. It's great to have you all here today.
Thank you.
Thank you. We'll start our question and answer session now. So just a reminder to our audience members, if you have any questions for our panelists, please use the Q&A box and we'll keep monitoring that for any questions or reflections you may have. We'd love to hear your thoughts. But to get us started, I might ask you all to answer this question, and it might be a big question as well to start with, but what does it mean to you to include the child's voice in the context of family violence risk assessment and management? Anyone's welcome to start first.
I can go first.
Thanks, Astrid.
Yeah, I was thinking about this question. I think, oh gosh, it means so many things. And I think what I really like to see is that we're not treating children's experiences of family violence as extensions, just mirror images of their, adult victim survivor caregivers. I think I really want to see their unique, what their unique experience was and the unique risks. And I really like to see thought given to what was the impact for that child in particular, and what does that mean for their sense of stability, safety, development, and really how do they make meaning of those sorts of things?
Thanks, Astrid. Catherine or Kylie?
Yeah, I think I'd like to add that I think it's also really important that whilst we're doing that, we're holding in mind the MARAM, and making sure that we are always updating that alongside the information that we do get, particularly the impact for the child or children, because, that's such a vital part, as you said, Astrid, in regard to not just an extension of being part of the family violence, but they're actually victims also, and their voice absolutely needs to be heard. And so I think that's a really important thing. And I think just adding to what you're also saying, that the parent is also a really important part in this process, and sometimes a parent may need to be there with the child or a safe caregiver, to be able to start that process. But then it's really important if we can get that opportunity to then, step in and just be able to see the child on their own as well, because that obviously can then allow us to add some different perspectives and allow the child to talk in a different way, have a different space.
Absolutely. Thanks, Kylie. Catherine?
I would add that in a lot of our service systems that we use, the mother or the parent is usually our official client and the children are not. And so it's really important that we recognise that children are individuals on their own and that they are a really important part of the story, and they also deserve to have their voices heard, that they deserve to have attention on what they're going through, what they've experienced, on their healing, on their recovery, on their future, and that it doesn't just revolve around the traditional service user or identified service user of the mum. Yeah.
And sorry, if I can just add to that too, Catherine, I think that often it's a really, as you said, a great opportunity to see both the mother and the child together, but also understand and maybe appreciate how much the adult can hold the child, and the safety that they might be able to provide. That's always a really good thing to think about too in that space, isn't it? Helps you to sort of, appreciate what the child might be experiencing.
That's a great point, Kylie, and thank you for sharing, Catherine, as well. Catherine, I might ask you our next question. I know we mentioned during those answers there how important updating the MARAM is. Can you share how can responsibilities 3 and 4 support more child-inclusive risk assessment and management in your practice or service system?
Again, just going back to mothers often being identified as our primary client, just being able to do a separate MARAM for children and not including children as just an add-on to mum's MARAM is really helpful. And just being able to, if we're able as practitioners, to spend time with children and ask questions, in a trauma-informed way, of course. We don't want to add to what they've already been through, but understanding what they're experiencing, what their feelings are now, what their understanding of what has been happening is, to get a better idea of what sort of risk they're facing. This, I guess, has to be taken in context with what mum or caregiver is also sharing and disclosing, and then I guess responding to that. So looking at the protective factors involved with the child. So is that mum? Is that a teacher? Is that another caregiver? Is that somebody else in community? Looking at ways to safety plan with the child that might be even a little bit different than we're safety planning with mum. Are there things that the child can do to keep themselves safe? Can they go to their room and do a specific activity? Can they put headphones on? Can they, take their younger brother or sister with them? Are there things that are specific to the child that might be a bit different than what mum is doing or their other caregiver is doing? So just really honing in on age-appropriate, trauma-informed things that I guess are from the perspective of children. Yeah, I guess that's what I would say.
Yeah, amazing. Thank you. I think that's a great point and great use of words, perspective of children, and thinking about really putting ourselves in their shoes and what will be best for them. So thank you for sharing that. That was wonderful. Astrid, I
Emma,
might.
oh,
Yeah,
so
go ahead, Kylie.
can I just jump in? I wondered whether this might be an appropriate time to think about, with Catherine and Astrid, particularly about infants and toddlers and how we might, because I know that that's a question that, is on people's minds too, is we're focusing on a 12-year-old here, but the reality is, as you said, Catherine, sometimes they might take a younger child into their bedroom, or there's often more than one child. And, I think we often, babies and toddlers are sometimes invisible in this space. So I wonder whether this is an opportunity for us just to think together a little bit about that. And some of my thoughts would be, around being able to observe the child or the toddler or the infant, in a space either with the parent or, and then in a different space in childcare, something like that could be really helpful to get a bit of a comparison about how that might feel in the family home, if it's safe, compared to in a more public space where they might have a safe carer, alongside them too. Getting feedback, as you said, Catherine, from schools or kinder, childcare, maternal health nurse, those sorts of things could be really helpful. What about, have you two got any other thoughts around just, thinking around holding the infant or the toddler in mind? Sleep patterns, those sorts of things I'm thinking too.
I feel like you've taken the words from my mouth and what I was
Yeah.
thinking about with my next question, which I love. Did I? Is that the... Well, it's not the next question,
Oh,
but
good.
when I was thinking about the next question, I thought, gosh, what about when we see our little babies that we do see? You're absolutely
Yes.
right.
Yeah.
Um, I'm happy to speak more to it, but yeah, Catherine, because I've contextualized it in terms of direct engagement. I don't know if Catherine, you wanted to add anything.
I think it's a challenge with small children and babies. We have to rely on other people to assist, and I think it kind of takes a little bit of a village to keep the smaller children safer, and we have to rely on other people who have eyes on those small children. We can't do it all on our own. We don't probably have enough contact to be able to determine everything that needs to be determined or observe everything that needs to be observed. So I think you're right, Harley. We need to call on, GPs, maternal child health nurse, daycares, all of those things to help keep small children in particular safe.
Yeah, amazing. Thanks, Kylie. Thanks, Catherine. Yeah, and Kylie, that was a great point around infants and toddlers, especially I know because we had some interest from the audience around how we engage with that particular cohort. So thank you for bringing that up. I think that's really useful, and it does draw nicely into Astrid's next question, which is what factors influence your decision to assess risk directly versus indirectly with a child or young person?
Yeah, thank you, Emma. So yes, there are so many factors, and obviously age and stage is absolutely one of our considerations. But I think something that, just thinking about your question, Carly, something that historically we might have undervalued, sorry, at least here in an Orange Door context, is sometimes it's who turns up at our offices or who is at home when we're doing a home visit. And yes, we often do get parents with very young bubs presenting on site. And I think historically we sort of haven't thought too much about that young baby or that young child who is attending. But actually, in fact, we often have opportunity to, yes, make observations, but also interact with those children and young people. And we might not necessarily be doing a direct risk assessment with a 3-year-old, unlikely, but we're certainly able to make notes, to observe, to interact. And I think also additionally, I think Kylie and Catherine, what you were talking about before in terms of often the mum who's holding the safety for that baby, we can really see in that sort of direct engagement, see all the ways in which that parent is keeping that child safe. That sometimes just goes under the radar a little bit because it's just seen as the norm, but in the context of family violence, it is that much harder. I think the other things that we take into consideration in terms of whether we indirectly or directly engage is our ability to create a truly safe space for a child or young person. The Orange Door is a really short-term, kind of adult-centric service at the end of the day. And often we find that children and young people are also already engaged with other supports that are sort of much more long-term, and they've already established that safety. And we don't like to come in over the top of that, sort of plonk ourselves into a child's life. We don't feel like that's particularly safe. But again, like Catherine was saying, we do rely a lot on other people's perspectives, caregivers, professionals, those sorts of things. But I'd also probably like to add that here in the Orange Door, I guess we also get a lot of, or not a lot, we get young people self-referring, either because there's family violence in their family of origin is often a primary presenting reason, but also young people experiencing family violence in intimate partner relationships with their peers. So we're absolutely directly engaging with those young people in their risk assessment processes. And sometimes when I get a little bit caught up in, oh gosh, what damage am I going to do? Or I'm quite nervous about engaging directly, what have you, I also just like to remind myself that, gosh, that child or young person, they've lived through the family violence that I'm just sort of here to support with. And I find that a helpful reminder. It doesn't always mean that I choose to directly engage, but just a reminder that, you know, as a service system, I need to remember that I need to, I really want to do my best to honour what they've already lived through. And that just also is a factor that helps me when I'm considering how to engage.
Absolutely. Thank you, Astrid. We have had a couple of reflections in our question and answer box from Anne-Marie, just talking about skilling the mother and father up about protecting infants and toddlers, and also taking the opportunity to offer primary prevention and safe relationships, especially if mum doesn't want to leave. So I think those are some really important points. Thanks, Anne-Marie. Did anyone have any reflections on those points before we move on to our next question? All good? Amazing. We might move on to Kylie. So we talked about assessing risk directly with or indirectly with children and young people, but we're moving on to focusing more on direct risk assessment. What are some effective methods you've used or seen used in this space when working with children and young people?
Yes, well, another big question. And, I think just want to, I guess, put out there that, working from 0 to 18 in this space is really, is really challenging in the sense that there's so many different stages, isn't there? And your ability to actually be able to connect and build a relationship and develop some safety and trust, and then be able to, I guess, bring out information or understanding from the young person will really depend on the age. So I'm sort of going to do a little bit of a thinking across a few different ages, but obviously not able to cover everything. Very happy to, if anyone's got any specific questions they want to put in the question and answer, and if we can answer them before the end of the hour or get back to them, very happy to do that too. I think initially it is really about having a really good understanding about what the young person or child, infant or toddler has been through initially, a really good history of their experience, so that we can, I guess, get a feel for what they can potentially manage. So, in that first little part or first session or so, really getting a good grasp and a good background so that we don't harm the children any more than what they've already experienced. So I think that would just be sort of what I'd put in there first and foremost. Some of the really good ways to, and understanding their interests too, I think is a really good thing, because that can be a fantastic way to then engage with a young person and help them to talk about their experience, or share how they're feeling. Sometimes too, that can be really helpful when you've got a young person that might not be able to speak, but if you understand their interests and those sorts of things, you can sometimes do it in the third person, or you might talk about it as far as a character might go, or bring someone else in that they value or admire, and think about how they might tell that story, or how they might be feeling, or what might be going on for them. So that's often a helpful way with young people that aren't able to talk about their experience directly. Things like good dream, bad dream, are often a really great tool to use with a young person. Sand tray is often a wonderful experience, whether it's creating a place that they'd like to go to, or a place where they currently are, and what might be some of the things that they connect in with or feel safe with. What are some of the things that are scary for them in those places? Being able to draw into young people's imagination and play is often really good. And again, depending on the age, songs that represent different things to them. So maybe this is for your older age groups, that are listening to a lot of music and understanding what that might represent for them can be really helpful to draw out information too. I think circular questions, and really being curious, and curious questions around things like, who laughs the loudest in the house? Who has the loudest voice? Who does the washing up? What jobs do you do? Things like that. Does your brother, help out around the house? What does he do? And when Dad gets home, do you sit and watch telly? Who do you sit and watch telly with? Things like that can be really just that sort of curious wondering about where different people sit within the house, in the roles they play within the family. And again, it depends on age and stage with those sorts of things, I think. Often it's great to really help young people to think about other people that they feel safe with. So getting them to name, and often just drawing a hand can be a great thing on a bit of paper, drawing their hand with them in the room on a bit of paper and getting them to name 5 people that they feel that safe with. Or if they can't do 5 people, it might be a couple of people, and it might then be some things that they could do to keep themselves safe. So again, just being able to really help them to think about what other options that they have when they're in that space. And I guess it's also possible, depending on age and stage, again, to think about apps that might be appropriate for young people to use. Kids Helpline, the Orange Door, as you said, Astrid, intimate partner violence, particularly in our teenage, and young adults, is so high. The statistics. So again, thinking about that could be really important in that space. So that's just I guess, a bit of a general sort of overlay of some of the things that I think can be really helpful. Have I answered the question enough, do you think? Or
Yeah, excuse me, absolutely. I think you've given so many practical strategies which are really useful, and it's definitely what people look for when coming to these things. I think more than anything, there's practical strategies. So thank you, Kylie. It was great.
pleasure.
We've talked about risk assessment with children and young people. We might move on to talking about safety planning now, and I'll open up this question to all 3 of you. But how do you tailor safety planning to meet the development needs and capacities of the child or young person? Anyone's welcome to go first.
All right. Well, since I've got my
Yeah.
mic open, I may as well do some more talking. Again, I think it's really important to ensure that we centre the child's voice in whichever way we do it. And we've done a lot of work with Why Change, which is a wonderful organisation that are all, is driven by young people who have experienced family violence, and hearing their perspectives is so valuable in this space. So I think what I initially would encourage, that any safety planning that's done is really done centering that child's voice, as we've talked about, and ensuring that we're meeting their needs. Because if we can't connect in with them in this space, no amount of safety planning is going to work. We really need to be able to have a connection with them, and for them to feel like they can take this on board, and that they've been listened to and heard. So I'll just stop there and let Catherine jump in, because I've seen her pop her little mic off.
Yeah, I guess there needs to be an understanding of what safety feels like. I think really talking with children about what feels safe to them. because as adults, we might have an understanding of what safety is that's very different than what it is for children. And that's going to be different depending on their age and you know, what they've been through. And I think even an acknowledgement that they have done well to keep themselves safe thus far, and just exploring what safety means for them and encouraging them with things that have been, you know, working for them, and finding out how we can strengthen those things that they have been doing that have been working, and trying to link that in also with their caregivers' safety plan, so that there is some cohesion and people are working together, children and caregivers are working together, so that there is more safety, I guess. Yeah, I think it's about talking about feelings, really, because the feelings of safety is going to help identify what they're happy to do, rather than adults coming in and saying, well, this is what safety looks like and this is what we want you to do, rather than, you know, really talking with children and saying, well, when do you feel safe? What does safety feel like? What do you think it looks like? And then planning from there, rather than people coming in and being bossy and not giving children a voice, which is what we really want. We want to hear the children's voice and let them have some agency, acknowledge their work in the past and strengthen that and build on that.
And Catherine, if I can just add to that, I think just linking back in with the last question around the activities, what sort of, you know, things you might do with young people, I think that's a really great thing to hold in mind when you're doing that work, when you're doing those interventions, is around what safety looks like for the young person or the child, because those activities could really draw that out. You know, so I think that's just a really good thing for people to hold in mind in that space.
And the only thing I would add on to what Carly and Catherine have already talked about is sometimes I think, and this is not necessarily direct safety planning with children and young people, more with their caregivers around, unfortunately, the grim reality of safety planning, and that sometimes we're asking people to choose between a lack of safety because of family violence and a lack of safety for a number of other reasons, homelessness, poverty, no access to supports or what have you. And so I think for us in the service system, it's also trying to where remaining in family violence might be the safest option. Also being able to reflect that in our documentation, and being able to sort of speak to the barriers that exist that leave this as a safer option for that child or young person and parent. That's a bit grim. Sorry, I just wanted to add that on.
I think that's a fantastic point to make, because I also think, Astrid, that it helps inform other services. So, you know, because we often think about when we do a report or an assessment for a young person, you know, how can we make that the best we can to help other people understand this young person's experience, so that it's not misunderstood, there's no assumptions, you know, those sorts of things are so valuable, aren't they? Because not everyone has the same expertise as someone else might have. And family violence is definitely one of those areas where I think the general overall knowledge within the service system is lacking. And so really being able to represent those sorts of things is so valuable.
Absolutely. Thanks all. We've had another reflection in the question and answer box just to talk about the children's needs. So whether that's a go bag, toy bottle, formula, nappies, dummies, comfort toy, blanket, a place to go in the home that you can lock yourself in. On a farm, so specific to Haley's case, is designate a safe area to hide with your phone, call 000. teach the victim survivor what lethality looks like to them, what is their level of tolerance, etc. A wonderful reflection. Thank you so much for sharing that today. We might move on to exploring Hayley's case a bit more in depth now and discussing some more practical strategies for children like her. As we heard in that reflection, there was a brief mention about being on a farm and what you might do in those sort of situations in rural and regional areas. But I'll open up the first question for Hayley's case to everyone once again. So based on what Hayley shared, how would you assess her current safety and risk of harm? And what additional information would you want to gather from Hayley or from other services that she might be engaging with? Once again, open floor. Kylie, thank you.
Sorry, Catherine. We
okay.
both clicked it. We're all being too polite, aren't we? I think it's really important in this space to make sure that we're using a very similar language for Hayley as well. So Hayley has mentioned that she loves to draw and paint. So and watch YouTube. So however we assess her risk, I think we need to make sure that we're doing it in a way that's going to encourage her to want to explore that. And she's articulated quite a lot about how she's feeling, which is fantastic because it gives us a lot of opportunity to then talk to her about that. And acknowledge her worries and acknowledge I guess how difficult it might be for her, and her courage in speaking up, I think, are really important. But also really clarifying our role is going to be important in that space as well. And then I suppose by activities and things we've talked about, making sure, as Catherine was saying earlier, that we are understanding what safety looks like for her, what is frightening for her, what is it may be a typical day like. Those sorts of things can be really helpful to get a sense of what might be going on for this young person, along with understanding it from other systems perspective. So checking in with schools and whether they've noticed any changes and particular reasons why, interactions with other children and when that may differ, pickups, drop-offs, how that a young child might be after or before those sorts of valuable attunement and attachment type things are really important to think about too. I think when we're thinking about different ages and stages with children, that can really tell us a lot about their safety and their current risk of harm. So that's just some thoughts from me.
I guess the thing that I would add too is just actually looking at the various intersections that add to what Hayley has told us. There's things like the geographical isolation, living on a farm, the fact that she likely is not able to run across the road or next door to the neighbours. That's adds to the risk. It sounds like her mum is really just trying to minimise things, which is also causing Hayley to minimise things. So that adds to the risk as well. There's not an acknowledgement really from her mum about what is happening. And so that adds to the instability, I guess, and maybe the fear levels of Hayley, because she really doesn't know what's going on, because she's probably seeing things, but it's not being confirmed by her mother. I do think absolutely consultation with other professionals would be needed, but I really wonder if some some mapping maybe of the various intersections might be helpful, and then looking at the MARAM risk factors and assessing where we think Hayley might sit within those would be really helpful.
That's a great point. Thanks, Catherine, and thanks, Kylie, for your earlier reflections. Astrid, did you have anything to add there?
Oh, I was having lots of feelings when I was reading the case study, and I think something that really stands out, and if I had the opportunity, to be speaking with Hayley or her mum as well, just what really stands out is how torn she feels, and how worried she is about the situation, but I suspect also how worried she is about her relationship with her dad ongoing, and I think that puts her in a real sort of between a rock and a hard place, particularly at her age. And so I think with someone like Hayley, if I was engaging directly with her and if we had sort of created a safe space to do so, I'd also really kind of want to go step by step and make sure that she also knew what my next steps would be as well, and sort of inviting her to participate in shaping what that might look like, and I suppose being really transparent. We've all got our mandatory reporting obligations and what have you, but being really transparent, if I could, with someone like Hayley and getting her input, because I feel like I'll miss things if it's just the world according to me, and mum. If I'm, I feel like, yeah, Hayley would have her own insights and her own perspectives that she might, yeah, that I think would be really helpful for me to be made aware of, and to hopefully sort of give some control to her as well. Yeah.
And I think that really links into that next question on the sorry, Emma, just in regard to the next question on this case scenario, with regard to how might Hayley's minimisation of fear influence your assessment and response. And I think there's what you said then, a lot of that is about that, isn't it? And really sitting with the trickiness of of being in this space, because I get a real sense too that there's some sort of responsibility here for her mother as well. So this is a kid who's really quite torn, isn't she? Because as you said, Catherine, mum hasn't really acknowledged that there is this fear, and so and mum doesn't seem necessarily. Mum sounds like she's got she's working on her own fear, and managing to try to keep herself afloat and functioning every day as best she can. So it would be very hard for her to hold Hayley in mind too. And it must be very confusing for Hayley. So I think that's something we really need to be mindful of when we're thinking about her minimisation.
Yeah, absolutely. Catherine?
Yeah, I was just going to add that, just a generalisation, just in respect to Hayley being an only child, and often, this is my generalisation, often only children relate more to adults, and there is kind of a I don't know if parentification is the right word, but I'm just thinking about Hayley's feelings of responsibility towards her mother, and how that's influencing her to not be truthful with other adults, such as the police, or but I get the feeling it's other people in her life as well, that she's doing this whole minimisation thing because she feels that she's responsible for her mum in some way. And I guess there might have to be some, psychoeducation around all of this, and just working with Hayley to help her understand what her responsibilities are as a child, and responsibilities for adults, and so forth. because that minimisation is really going to impact her understanding of whether or not she is in danger, whether or not she needs a safety plan, and how she's going to respond to everything that's happening in her home. So I think that's really important to understand as well.
And I think a way to do that too is just to ensure that whilst we're still waiting for our child and young person MARAM to come out, is ensuring that in the adult version that we are really representing some of that information in there, Catherine, isn't it? So
Yes,
that
for sure.
other people, other services can also understand, what is going on and how she's feeling and thinking.
Absolutely.
Thanks all. Just going back to, I think, a recurring theme that was going on throughout that conversation around Hayley's relationship with her parents. We've had a reflection in the question and answer box around supporting the child to identify who the safe people are to talk to. And this is important as the adult using family violence will often threaten them with negative outcomes if they tell their protective parent, or they might not want to worry or burden their protective parent. And also going back, we also had a question from the audience earlier around how we might safety plan with a child who is really fond of the person using violence and will not and cannot acknowledge that they might be unsafe. Did you have any reflections around that? It's a big one, that one. I know we might have to take that on notice.
Well, I mean, I would say I do talk about this with young people, and I often give an example of how parents love their children even when they do things that the parents don't like, when perhaps the children have done something like write on the walls with crayon, or I don't know, whatever else. And I find that easy to explain because children can understand. This is obviously another generalization, but a lot of children can understand that their parents would still love them even when they do something wrong, but they don't love the behaviour. And so if I'm speaking to a child or a young person about their feelings toward their caregiver who's using violence, I can talk to them about, yes, you can still love that person, but not love their behaviour. And I think that in that way, we can sort of teach people to separate the two things, and help them to look at it a little bit differently. And if they can start to think that way, that they can still have positive feelings towards somebody because of the position that they hold, that's okay, but they don't have to put up with the behaviour. And they can have boundaries around the behaviour, and they can have boundaries, therefore, around the person because of the behaviour and that they are choosing to do or engage in. I think that's really helpful. I have had some success, particularly with young people, probably less with smaller children, but with young people, that's actually been helpful to discuss it in that way. I don't know what do the rest of you say.
I was just thinking about what you were saying. I really like that, Catherine, because I think what you can see there is you're preserving and you're respecting that relationship. That's, a child and their parent, they're going to be connected forever. They'll always be their child. And you're not dismissing that relationship because of the behavior, which I think is just so critical. We wouldn't do it to an adult victim survivor. Why would we do it to a child? And I think that's a really helpful way. Now I'm thinking about how I'm going to do it next time. That's a really helpful way to put it to a young person. Thank you.
And I wonder if I know we're short for time, but I just wonder if we can also honour in that, because I agree, it was a wonderful explanation and something that's so valuable, isn't it, to use and helps young people to really sort of get it, or can, is honouring the younger children, the infants and the toddlers, and in this space. And I'm picturing a 3 or a 4-year-old again thinking about how can they, they love their dad, and how do they determine safety, in that space, and how can we help them with that, which is a little bit more tricky, I think, because they haven't got the age and stage, the agency yet, and the brain development to be able to do that. And I think that's where, again, in this space, we have to rely on those safe, trusted adults, in their lives, be it at kinder, be it auntie, uncle, grandparent, mum, whatever, or dad, whoever it might be. But I think, yeah, that's just a reflection I wanted to add in, just thinking about the younger kids in that space.
Absolutely. Thank you all. Yeah, just conscious of time as we only have a couple of minutes left. We had a question from the audience around practical tips for working with young people who may be neurodivergent or have a disability. We might take this one on notice. I'll share it with the panelists after our session, and we'll provide some resources that we can share with you along with the recording of the webinar. So we will get back to you on that question. But just to round out this conversation, I'll open the floor to all of you. And if you could keep your answers brief, as we only have a couple of minutes, that would be appreciated. But if you could give one piece of advice to practitioners working with children like Hayley, what would it be?
For me, it would be, if you had the opportunity to directly engage, to really be your authentic self and offer Hayley respect and transparency when you're engaging with her.
And I would add to that consistency and reliability. I can't tell you how important that is. Just always showing up, always being there when you say you're going to be there, always saying what you're going to do, you're going to do. That's so important for young people in this space.
And I guess I would add, be curious and listen well.
Amazing. Thank you all. That was wonderful. Bear with me as I share my screen for one final time. Kylie, you have your hand up? Oh, no, all good. No stress. Thank you everyone for joining us, and thank you once again to Astrid, Catherine, and Kylie for having this wonderful conversation today. So if you could all please put your virtual hands together and give them a round of applause and thanks, that would be wonderful. But we hope this session has deepened your understanding of how to include children's voices in risk assessment and in management. It would be great if you could take a moment to complete the post-session survey, as it will help us improve future sessions. I've posted a link in the chat, but there's also the QR code on the screen. As for next steps and closing the session recording will be shared with you at a later date, along with any resources discussed today, and we will get back to you on that neurodivergent and disability question as well. Stay tuned for session 3 in the series, which is occurring on Monday, the 20th of October, and that will explore implementing the information sharing schemes across care teams. If you have any questions or would like to follow up, please feel free to contact me directly. Thank you once again for joining us today. I hope you have a wonderful afternoon. Thanks all.
Thanks everyone. Have a good day.